I found out about this funding being turned off while we were doing a measles simulation exercise. And I was looking around at staff whose very livelihoods are supported by those funds that we were fully expected to have through the end of the year.
The full picture of federal funding cuts is still unclear. To Jeffco Public Health Executive Director Dr. Sarah Story.
We don't know the hard number. We do know it's probably going to be somewhere in the ballpark of $500,000 to $1.5 to $2 million.
If it does end, when? I've got staff, human beings that could be impacted on this.
And Larimer County Public Health Director Tom Gonzalez.
We've been doing work all year, and we've been reimbursed up to January. So was February or March impacted?
The Colorado Department of Public Health and Environment says 4 federal grants were terminated, a loss of about $200 million the state thought it still had to spend on getting COVID vaccines to high-risk or low-income vulnerable populations, addressing health disparities in minority populations and rural communities, and disease prevention programs.
If we can't pay for this with funds promised from the federal government, it is the Jefferson County taxpayer who will foot the bill for these services that are legally mandated.
COVID may not be what it once was, but it's not gone. And even more pressing is the next outbreak, already at Colorado's doorstep.
We're preparing for a measles outbreak in Colorado. It has been in every surrounding neighboring state, so we know it's only a matter of time.
This funding was meant for filling in the gaps and mismarks during the pandemic. And we learned from those, which is so valuable, and we want to do better next time. I'm afraid that those lessons learned and those things may be forgotten or not implemented.